AI doesn't even know what the system is. Like, you can't throw AI at a fax machine. It would just step on it too. Could you imagine put in an AI in Claude and go, "How is a fax machine work? What is a fax machine?" You're like, "This is an outdated technology that's not used anymore. Please don't use it."
And here, and I'll tie this back to the finance because this is a big portion of this, right? Nothing in medical works without somebody getting paid. And the problem that we face because of all this interoperability mess is that reimbursement has gone down, and this is staggering. The laboratory which we're all relying on to do the good work, to give me the precision medicine diagnostics that I need, most labs are like 30 to 40% reimbursement. That means that when they're doing all that yeah, it's terrible. And so they're in a struggle and they're always holding the bag. And if a doctor doesn't like them for whatever kind of reason, if something just goes wrong, there's a million other labs that they'll go with, and the doctor really doesn't care. So what we're also trying to do is so we work with Thermo Fisher a little bit with some of their departments, and one of their biggest things, and these are really large teams that hit global markets with very some of the best equipment on the planet. And what they're saying is the labs that we're doing business with are having trouble with reimbursement. My machine doesn't help with that. What is the process that we can show that things were done correctly to be able to facilitate getting paid to run the sample to be able to get better results back to your doctor, which ultimately leads to better patient care.
Wow. So there's a lot of room for improvement. You guys can help, but obviously the entity and the structure entirely globally needs to be looked at as well. But you're trying to do a stopgap in the meantime with as much as you can do. Now, with your testing, and I know we were talking before about XY gene and PGX, maybe go into a little bit about, and I'm trying to read these words. These are like beyond my scope of the pharmacogenomics. Am I close or no? I probably missed that word all.
Pharmacogenomics, or PGX for short.
Yeah. Okay, so PGX, and XY gene, obviously, maybe you can go into the details of how those part work within the scope of what would work for your healthcare provider or or doctor, whatever. Yeah.
XY gene, we actually kind of were really excited about the concept of genomics, hence that part of our name. And what we've discovered is, they've unlocked the genome, right? They've mapped the whole thing, and we have it, which yeah, which means that what we're able to do now.
You can do 21andMe or 23andMe, whatever, and do this genetic testing of where you're from. But what about the future where you're going to medically wise?
That's actually a really good point, Craig. So think about like the 23s and these and the ancestry.coms and those kind of, they blew up and were, billions of dollars business. Now there's some problems now that we're learning about them. Fair enough. But people were really excited on a cash-based pay test. Like my doctor wasn't involved. They found out, hey, I can discover things about myself. And what they were able to get because of that is they were able to kind of get lineage and history and things like that, which I think is a really important component. But and when we look at like other parts of the world who still haven't been really tested at a large degree, like we don't understand a lot of full cultures because like they've been underserved with genomic testing. So we don't know a lot about how the medicine for me, a really white guy, somewhere up in the United States versus somebody who is, I don't know, from the Caribbean, for example. We have different genomic backgrounds, and medicines and technologies are developed around that. And so some of that's really early around the world, and it's getting more and more tested, but a long way to go. But because people got interested in what genomics could do, medicine development and discovery about how you as a person versus you as a cohort or a big group of people is very different. That when we're talking precision medicine, it would be like before genomics, it was kind of like a shotgun. You're going to try to, spray and pray a little bit. But now we're really down to a sniper rifle. Like you can get a very targeted approach. And you brought up PGX. So I think PGX, for your listeners, this is a really great thing because it's kind of at the forefront of how genomics is being utilized in at least in the United States and abroad. For people who are listening who might be on Medicare, by the way, it's a covered expense.